Hi, my name is Blankita Marie Francis. My student ID number is 3006519, and this is for my radiology course. I'm going to give you a few key points on radiology. First point is going to be, how do we monitor radiation? Well, our monitoring device is called a dosimeter, and what it does is it tracks and evaluates the ALAR procedures, which are as low as reasonably achievable. It also ensures individuals do not get overexposed to radiation, and it differentiates between the different types of radiation. It should be worn on the outside of the lead apron and at the collar. I'll go over the personal protection equipment or the lead apron in a second. Also, there is, for veterinary occupational personnel, we have a 5,000 milliremps maximum permissible dose that we can be exposed to. I also have a radiation detection report that comes from our radiation detection company. As you can see, for most of our employees, there is a ND, which means non-detectable amount, and for the other employees, such as Annie Hart, we have a very limited amount of permissible dose. That's 11 versus 5,000. It's not significant at all, very reasonable. That's how we interpret that. We also have, for our personal protection equipment, we have the lead apron or gown. It straps in the back at the shoulders, and it comes across the waist, behind, and to the front, and ties. We also have our thyroid collar, which fastens behind the neck and protects our thyroid gland. Lastly, we have our gloves, which protects us. All of this equipment only protects us against scattered radiation. It does not protect us against the primary beam. Every time you put on your personal protection equipment, you want to look at it and make sure to inspect it visibly for any cracks, creases, holes, bite marks, anything that could have penetrated the lead lining of the equipment. Also, every 6 months, you want to take a radiograph of the gloves, and every 12 months, you want to take a radiograph of the gown to ensure that there are not any defects that are not visible to the eye. Okay, and then you're going to place your dosimeter badge on the collar of the lead apron, above the waist, but below the thyroid gland, and at the front. Now, there are 3 different types of restraint. There are the troughed, V-trough, which can also be used as a positioning aid, but for us, it has straps on it, so it can secure limbs without personnel having to physically do so themselves. As well, there is tape, there's rope, and there's gauze. This allows us to secure the pet and the patient in a position that is needed for the view without being obscured by a glove. It also can allow us to secure the patient here and allow us to step out behind our lead-lined walls to extend the foot pedal to take the exposure outside of the surgery suite, limiting exposure to personnel. As I just said, even though this can be used as a restraint, it's also used as a positioning aid. So our sandbags and bean bags, foam wedges as well can be used as positioning aids. So now we're going to discuss time and distance as a safety measurement. We're going to, time is referred to as doing it correctly the first time on the right setting and the pets in the right position so you don't have to do retakes. Distance is allowing us to be as far from the primary beam as possible, and sometimes, if able, far from the patient as possible. Which brings us to our third type of restraint, which is going to be a chemical restraint, which could be an injectable or an inhalant anesthesia. This allows us to safely position the pet, take the x-ray, as well as being as far away from the primary beam and the patient as possible. Non-essential personnel should be removed from the from the radiology suite to limit the exposure or the unnecessary exposure, the amount of unnecessary exposure. But people under the age of 18 and women who might be pregnant should also be protected, because exposure to radiation results in intracellular water being ionized, which can result in damage to components of cells such as DNA and reproductive cells such as eggs and sperm. It results in genetic damage that occurs to the person receiving the exposure and for the generations to come. That is why people under the age of 18 who are still developing and growing and maturing are more sensitive to radiation, as well as women who are pregnant, especially in their first trimester, when the fetus is more sensitive to these exposures. So I'm going to show you how to request a x-ray through our digital system, which is Cornerstone. You go into the patient's file, you go into the patient visit list, which is basically where you invoice items that or services that have been acquired or rendered. You'll press F2, which is our search engine for the Cornerstones, and you'll put in x-ray. Now for x-ray, there are multiple views. It's just 1 through 6, and then there's additional. For this patient, we're going to do, let's say 5. Then it's going to ask for the staff or the doctor who's going to be requesting these views, which is going to be my preceptor, which is Dr. Ford. And then you're going to come over here, and we're going to select patient within the PAC system, which is on our digital computer. Oh, and look at there, it's already up. So then you're going to select your patient. And then you're going to go in and do the views. At this point is when you'll start to do the measuring for the patient, which should already be in the position for the view you're wanting to take. I will show you the rest of these steps after we get our patient out and get everything ready. Give me one moment. Okay, so we are now going to be doing a cranial-caudal view of the radius and the ulna. First, you're going to put your pet in ventral recumbency with forelimb extended cranially and head deflected away from the affected limb, like so. Now the measurement is going to be the mid shaft of the radius ulna, which we just did, and the centering is also going to be the mid shaft. The collimation is going to be proximal to the elbow and distal to the carpus. The label is lateral to the radius and ulna. And that thing here. Okay, so we're going to. Oh, good job. And for the last part, which is going to be the VD, thorax. Patient is in dorsal recumbency, and we're going to extend the forelimbs cranially and the hind limbs caudally. The measurement is going to be at the highest area, which is normally the last rib. It's going to be the centering is going to be the midline level of the caudal border of the scapula, and the collimation is going to be between the thoracic inlet, the first lumbar vertebrae, the body wall, and the V trough entirely in the collimated area. Okay, and the labeling is going to be next to the axilla, which is the human equivalent of the armpit and elbow. Okay. Measure. Oh. Like I said, we already measured, but I'll show you how, I'll demonstrate how to do it again. And that's at 11. So we'll go ahead and now switch to KVP because everything else stays the same. The KVP gets turned to 70. And then it stays for the MAS and the MA. Okay, have my gloves on. I am now ready. Give me these legs. Those squirmy legs. Now that we have her centered, I'm going to show you how to do an OFA or extended hip projection for an OFA. So first you're going to take your caliper and you're going to measure the thickest part of the pelvis, which I have her at an 8. So if you look at the technique chart, 8, you're going to change the KVP is 70, your MAS to 1.2, and your MA to 300. So you go over here to the machine. And the KVP is brought down to 70, the MAS is brought down to 1.2, and the MA is set for 300. So we already have glazed our patient in a dorsal recumbency and a V trough. You can put foam pads on the lateral sides to keep from rotating. You want to extend the forelimbs cranially, the back legs caudally, and you're going to want to rotate the stifles medial so that the patellas are centered. Let's see. And the collimation label is going to be caudal aspect of the pelvis. Okay, now that we have everything in its proper place, oh, you got to make sure the tail is also straight and aligned. Okay. 1, 2. Okay, so here we are. Here is the x-ray, and I'm going to show you how to order when you send it to the patient profile. I'm going to show you how to label it there in Cornerstone. All right, thank you. Next video coming soon.
Ooh, beauty.
Okay, and that's the view. Pictures and labeling and annotation coming soon. I'll show you how to do that when we transfer the x-rays over to the patient's file, which we do by pressing this complete button. Then it automatically goes to our PAC system, which is partnered up with Cornerstone, and I will show you how to do that there. Thank you. So I am giving the barium. Okay.
Stop. Pause or what?
Yeah.
It's there. Going.
All right. Now we have just put our patient in lateral recumbency, and we've already set our machine because this is a very fast procedure. And now we're taking our picture.
Just tell me when to.
All right. Now that's the view that we have. If you can.
Okay, we're going.
Hi, we're going to be doing the elastography barium series. First things first, we already have our barium that my doctor went ahead and gave me the dosage for. We'll be using the barium sulfate liquid that can be mixed with food, but we're going to be giving it directly because we're looking more at motility. We're not looking at motility, we're looking for a suspected mass. We're going to give it standing up and then place the patient in lateral recumbency immediately after. And we're going to give the barium quickly, but not with a forceful flush to limit the lung aspiration of barium risk. Okay. So that's the view that we got for our barium series. All right, other views coming soon. Thank you.
Okay, so this is our radiology log. What you're first going to put in is the date. And then you want to go ahead and put in the client. The patient's name. What species. And then what we were looking at, the kind of projection, which was a extended hip for OFA purposes. If I remember correctly, the KVP was at 70, and the MAS is at 2. Alright, now the pet was very calm due to it being sedated, so there's no notes to add to it other than my doctor noted slight arthritis in hips.
My name is Dr. Terry Ford. I am the owner and operator of North Dallas Veterinary Hospital. Marie works for me and has been enrolled in this class. Since starting in the radiology block at school, she has really taken a special interest in it, almost as a photographer. Her technique is getting so much faster and more accurate, getting great images, great positioning. I think she and I both realized that anatomy is one of her only weaknesses in this area, and that's coming along really fast as far as knowing the points like knees, spinal processes, and rib edges. As far as getting the images, she knows anatomy there, but she does admit that she wants to get better at that. But it's just been a real joy to work with, and I'm proud of what she's accomplished in this short period of time. I think her attention for details is a real asset, because these images have to be done well and they have to be recorded and logged in well, and all the notes taken, and the bill has to be applied to the pet's bill. So she's got all that going. So with that, I would say that progressed very well, and her confidence, efficiency, and safety. She's very safety conscious and always wearing all her protection, getting her dosimeter tag put on, and warning other people in the area that she's taking x-rays. So Any questions, please give me a call at 972-620-9012. Thank you.